Okay, perfect. So good afternoon, everyone. My name's Laura Shearman. I'm a final year doctoral student at the University of West of England. This is the first time I've shared anything about my findings outside of my supervisory team. This is quite a momentous occasion for me. So thank you for taking the time to listen to me, and a big thank you to Phil for giving me this slot. So I'm going to share some of the insights from my doctoral work, which focuses on VR in health and social care curriculum in further education. From my study, I've drawn out some of the implications for practice when using VR in the classroom. Next slide, please. So this is a bit of an overview of what I'm going to talk about today. So I'm going to talk a bit about me, just give some context and background, outline some of the problems with students of VR in FE, I give you some context to my study and also some of the teaching considerations, which has actually evolved into a practice checklist, which are currently in the process of being implemented in an FE college. Next slide, please. So a bit about me. So I want to give a bit of context about me and my positionality within my doctoral work and what led me to VR. So I class myself as a dual professional, spanning the healthcare and education sectors. I've enjoyed quite a reasonably long career in healthcare, from frontline roles to senior management across multiple services. But since 2018, this is predominantly focused on older people services. I branched out into education in 2012, initially as a teacher in FE and HE, and progressed on to IQA roles and e-learning authorship at a national level. So I actually came across VR in 2018 for the first time, which was an Oculus Rift connected to a big computer, which was nothing short of jaw-dropping for me for a first experience. I've never experienced anything quite like it. And I started to think about VR for education back then. So for me, the issue I had in class was getting students with limited real-world experience to apply knowledge from the classroom into practice. Students do have industry placements as part of the qualification requirements, but this can be quite restrictive because of risks and age and student age, which is where I felt VR could perhaps bridge this gap and enhance student learning experiences. So just after the pandemic, I embarked on a PhD in 2021 to explore VR in FE. Next slide, please. So it's worth briefly pointing out what FE colleges are. So they're really places that centre on equipping young people with job-specific skills that are transferable to the workplace, and they're also involved in the delivery of lifelong learning for adults as well. Next slide, please. So when I started looking for studies in FE and VR, I didn't find very much at all. In fact, I didn't find any, which is a bit of a surprise for me. Most often studies were set in a HE context, which is different in FE in respect of educators, curriculum requirements, in-house resources and expertise that might be available to educators in HE. But also the demographic of students, which tend to be younger, they're much less experienced in industry and are more likely to be from a lower socioeconomic background. The studies I found tended to predominantly be quantitative. So you can see on that little figure, I found kind of 19 randomised controlled trials and 30 quasi-experimental studies. So the student and educators' voices were somewhat muted. Exposures to VR tended to be one-off, so they're not really focused on kind of teaching practice, but more on learning outcomes and usability. And often studies were located in a room outside the classroom, which is kind of difficult for FE because we just don't have such large campus space to work with. Next slide, please. So this is a quite interesting, when I was looking at the literature, I came across a paper by Buchanan, hope I pronounced that right, who frames VR as an extension of teacher practice and a curriculum aligned student learning. But the existing papers, to me, didn't explicitly speak to teaching practice or reflect educator voices or what happens inside an authentic VR facilitated class. So I kind of set out to explore this in more detail in my study. Next slide, please. So I decided to conduct a case study. So my study took place in a FE college in the southwest of England. My sample consisted of 14 final year health and social care students, 18 years of age, and that comprised of 13 females and one male. So, you know, it's kind of heavy towards, geared towards female students, which health and social care often is. I had one student with physical impairment in that cohort as well, and one educator. And I was able, fortunately, to interview other educators within the health social care faculty to gauge their experiences of VR as well. I adopted Bronfenbrenner's ecological systems model to explore VR at the individual and measure system levels to focus on the implementation of VR in the classroom. Next slide, please. In terms of VR exposure, students were exposed to 4 weeks of weekly VR learning sessions in which they completed in-class surveys and post-exposure interviews. I also observed each VR facilitated session and conducted educators with the educator. Next slide, please. This just outlines some of the content that students had access to. So each week, students had different types of content across different topics that they could explore. So they had sort of interactive and passive 360 video experiences, as well as access to computer-generated graphical content as well. So students could choose to access content on MetaQuest, so the untethered headsets, or a laptop. If you're interested in some of the content that students had access to, then you're welcome to scan the QR code on the right side of the screen or contact me, and I can happily provide a link to that for you as well. Next slide, please, Phil. So from my study, I identified 5 areas of practice consideration to the use of VR in FE, which have resulted in practice checklists, which are currently in the process of being deployed in FE College. So there's 5 key areas, so educator CPD, curriculum planning, student orientation, inclusion and equity, and student wellbeing. So I'm going to kind of give an overview of each one. Next slide, please. I looked at kind of educator CPD. Educators generally don't have high levels of digital competence or technical competence to manage VR in the classroom, which can present a barrier to VR adoption unless an institution provides specialist support, which in my study was in the form of a learning technologist, which isn't always possible because of resource constraints. So with that, we're kind of looking at considerations around foundational training for educators in sort of covering hardware, the types of VR apps that might be available to them for their curriculum area. And also included in that is a kind of information and guidance around 360 video content authoring, which tends to be more inexpensive, and there's a good wealth of tools available. And it also kind of overcome the issue that educators were talking about to me in terms of making sure VR content mapped and aligned to the curriculum area that they wanted. A lot of the content didn't that was off the shelf, so that was also a challenge. And there was also concerns about the amount of VR content available to thread across an academic year. I'm also looking at kind of considering pedagogical support in terms of embedding content into the curriculum. So looking at learning theory and how to manage students between the virtual and physical learning environments, which were kind of key knowledge areas that educators indicated they didn't feel particularly confident with. Next slide, please. There's also considerations around just curriculum planning as a component of pedagogy. So there's a temptation too often for educators to take a technology orientated approach. So seeing the technology and then leaping on the bandwagon because it looked interesting and something that students might enjoy, which kind of way evangelists kind of sit. On the other hand, there were educators who were unsure around where to start with VR, were kind of scared and didn't want to kind of get involved. So I guess to support both types of educator, we kind of considered looking at support around looking at positioning of VR, kind of what are the intended learning outcomes, how often do I want to use VR in that, and intended outcomes and sequencing. And also looking to the students as well to be involved in that process. Students quite like to get involved in kind of the co-production of curriculum. So looking at ways to bring in the student voice and asking questions around how do students feel about VR, where do they position VR, where are the gaps in curriculum for them, and where do they think that this technology could support them. And also kind of thinking about content type as well around, it's kind of basic level stuff, but it's just things that won't really be considered. So is it 360 video, computer generated environment, how much space do I need in my classroom, and kind of these kind of foundational considerations. Next slide, please. This is about student orientation. So students also needed to understand why they're using VR for their learning as well, and what purpose it kind of serves for them, because often it was seen as sort of a bit of a gaming tool, something that's not really used for education, which kind of put VR as a frame as a one-off novel experience, really. Moreover, students tend to be familiar with a range of educational technology, from maybe smartphones to laptops, tablets, and physical simulations. But although students reported a high level of digital confidence, they weren't necessarily confident or to feel competent to use a VR headset. So some students felt quite anxious about that, and had health and safety concerns that they wanted addressed before they would even attempt to put a VR headset on their head. So in practice, when they actually got to that point of setting up the headset, they needed a lot of support around setting up the Guardian, to navigate around the VR headset itself, to know the controls, which were kind of barriers to them really benefiting from VR itself. Even from the head strap. So on the Quest, you've got the stock head strap. It's quite fiddly to adjust. So we're kind of looking at suggestion of more, aftermarket straps with a bit more adjustment. It's a bit easier for students to get started with as well. Students in my study, VR wasn't cast to tablets, which meant support for students was quite difficult to deliver by educators and learning technologists. So there was this sort of idea that if a student had an issue, the headset had to be taken off and then looked at, then the student would put it back on again. So that kind of break in immersion, that kind of eroded the learning experience. Really, it was quite disruptive. So what I've highlighted here really is the need to explain the purpose of VR to students, an orientation to hardware, an introduction to VR apps before they're actually used in a classroom and for learning. Next slide, please. So kind of looking at student wellbeing. So when in VR experiences, some students felt overwhelmed and uncomfortable. So it's important to consider aspects of like psychological safety. So at the core of psychological safety is a concern for the removal of kind of negative emotions triggered by interactions with educational content. So maybe some students become stressed because of a connection to a personal experience that was triggered by some of the simulation experiences they were having. For some students, they hadn't been exposed to behaviour that challenges. So there was one simulation where the character looked directly at the camera, and students kind of were quite overwhelmed by that, got quite upset because they hadn't had that level of confrontation before. So some students actually felt quite emotionally connected to the characters, which caused them to feel a lot of empathy, which is quite positive. But on the other hand, it kind of resonated with them in terms of personal experiences of family members being unwell and poorly. So kind of looking at the suggestion of having debrief sessions to allow for reflection on learning and acknowledgement of emotions as well. Students can also feel quite kind of claustrophobic inside the headset, and isolated. So again, it's important to consider how we're supporting students when they're in these virtual worlds, as well as physical safety considerations. So regular breaks, so suggestion of sort of maximum 30 minutes to a sort of 15-minute break seem to work quite well. Making sure there's sufficient space as well for students to avoid kind of collisions, trips and falls. And there's kind of a recommendation as well to develop a screening tool to identify students that may have maybe at risk of adverse effects, to ensure that we're considering that when we're implementing VR into the classroom. And then final slide, I think. Thank you. So the final consideration looks at kind of inclusion and equity considerations. So obviously all students have the right to access education, and there are adaptations to VR hardware and learning content that is now possible with the majority of apps. So it's important to ensure that hardware and learning content is inclusive for students with additional learning needs, physical disabilities, and being aware of what these adaptations might look like. We've got students from different cultures as well, religions that can wear clothing that may cover their heads, which can make wearing a VR device quite challenging. We also know as well from the study and some of the literature that female students can experience more discomfort from wearing physical hardware because of anatomical differences. Therefore, an awareness of the type of adaptations that are available and learning content can help create an inclusive, positive VR environment. So even looking at things like adaptations to controls, having hand trackers, if it's a hand controller that someone can't use, maybe looking at a gaming controller, making sure that other sort of non-VR modalities are available, maybe on tablet or desktop, and looking at the way that the headsets fit or don't fit students as well, and making sure that maybe there's straps for just additional adjustments, and of course students wearing glasses as well. That's quite difficult. A lot of students, despite having the glasses spaces, would prefer just to remove their glasses as well, which created issues for visual issues for looking at the content as well. And finally, making sure that content is appropriate for all students. Yeah, next slide, please. So thank you very much for listening. I hope that was okay.
That was great, Laura. Thank you so much. Thank you. And again, some great reactions there.